MRCOG Part 3 is one of the most challenging clinical exams because it does not just test knowledge. It assesses how you think, communicate, prioritize under pressure. Many candidates fail not because they lack knowledge, but because they do not structure their answers in the way examiners expect. In this video, you will learn how to approach MRCOG Part 3 using a safe, structured, and examiner-focused method. Examiners are looking for safe, structured decision makers. I would like to stress the difference between knowledge and examiners' expectations. MRCOG Part 3 is about clinical judgment, communication, patient safety, professionalism, and ability to prioritize. It's about functioning safely as a registrar or a consultant and not just giving textbook answers. The biggest mistake candidates make is jumping straight into management and skipping structure or empathy, which immediately makes you lose marks. Another big mistake is not acknowledging patient concerns. There is a goal structure for all stations. You have to introduce yourself and make sure you maintain and create a rapport with the patient. You need to explore concerns, acknowledge emotions, explain clearly in non-medical jargon, make a management plan, safety net the patient, and check understanding. This framework works in every station. Each step shows professionalism and patient safety awareness. First impressions are very important. You need to introduce yourself and express your concerns. You need to confirm the details. Make sure you're aware of your body language, which should be open. For example, you may ask, "What can I do for you?" Or "What is it that is bothering you?" It's very important to listen as well and listen without interrupting the patients. Open-ended questions and empathy is a very high scoring step in the MRCOG Part 3. It's very important that you acknowledge emotions and be able to explain clearly to the patient. Clarity is very important to ensure patient understanding. Demonstrating empathy is a high scoring step. But this demonstration should not appear rehearsed. It should appear organic and generic. Make sure you use simple language, avoid difficult medical jargon, and break information into smaller parts. Always make a structured plan, immediate steps, investigations, and treatment options. Make sure you always safety net the patient. Safety netting demonstrates patient safety awareness, and structured management shows the examiner that you're thinking logically. It's very important that you check the understanding, which is crucial for scoring. Make sure that your patient is engaged and informed. You can use terms like, "Does that make sense? Do you have any questions? Is that something you want to ask?" It's important that you meet the examiner's expectations. Your decision making should come across as safe. You should be able to communicate clearly. Your structure to your station should be logical and empathetic. And you have to make sure that you can escalate where it is needed. Even in stations where you have not been able to demonstrate good knowledge, a safe, structured approach will usually score well. Using some of these phrases shows professionalism and maturity. Like, "My priority is your safety and your baby's well-being. I would like to discuss it with my senior colleague or my consultant and get back to you. We will monitor you closely." Terms like, "I'm not sure what's going on, but a period of observation will help us become more clearer to us the reasons why these symptoms are bothering you." The common reasons for failure includes unstructured answers, missing safety concerns, overuse of medical jargon, lack of empathy, not checking understanding, interrupting the patients. So it's very important to avoid these common pitfalls. Practice actively, not just reading notes. Make use of timed and realistic scenarios. Speak aloud loud. Get feedback wherever it's possible. It's very important that you think like an examiner. Ask yourself, would I trust this candidate to manage my patient's safety? If yes, then you're on the right track. Shift your mindset to the examiner's perspective. Safety and structured communications are the key for the success in MRCOG Part 3. Preparation and mindset are the key for first attempt success. So in order to summarize, use clear structure for every station. Focus on safety and communication. It's not only important to be a good doctor, the most important thing is to be a safe doctor. Practice speaking. Practice with your peers. Practice in front of the mirror, not just reading. And in the end, always think like an examiner. If you want to boost your exam success and pass in your first attempt, please have a look at www.onestopmrcog.co.uk. Thank you.